study was looking at a ultra-rare tumor, alveolar sulfate sarcoma, and evaluating a drug that is a VEGF targeting agent. I think what we saw in that study, the study didn't meet its defined endpoint, but we know that sort of that class of drugs has shown activity. A prior study using the same agent in a basket trial had a higher response rate, but in that study, they excluded patients who had had any prior VEGF therapy, whereas this current study did not. And so part of the reason for maybe not seeing the response rate they may have wanted may be related to that. The other thing that the patient population was more male than female, although, if you look at epidemiologic studies, it's actually the other way around. And there is at least one study that has suggested that males may have a worse prognosis. And so maybe just the patient population altogether was one that was more heavily pretreated and one that had a worse prognosis. Dr. Stacchiati, who presented the study, did point out in the patients who'd had VEGF therapy that their responses were lower than those who had not. So, I think it's an interesting drug. The safety in terms of the types of toxicities are really what we see with that class of drugs, and overall pretty well tolerated. And so I think it adds to the support of this being a class of drugs to use in that disease. One of the things that we know about that disease also is that it can respond to immunotherapies. And so the question is, in studies that have combined both a VEGF TKI with immunotherapy, we see some of the highest responses with longest duration of benefit. And so would that approach with this drug do better? And so I think it's not clear how the drug will move forward, particularly for that indication outside of China. But I think it's showing what we anticipate and is useful from that perspective from the data.